So it's 7 o'clock. Let me give you an overview. Welcome, everyone, to the Healthcare for All Washington meeting tonight. My name is Ronnie Shure. I'm the newly elected president, standing on Marcia Stedman's shoulders. Maybe this is the point where we move the video screens around so that you can really see that I'm standing on her shoulders to help move this organization forward. Tonight, we're going to talk about the new members of the new Universal Healthcare Commission. We invited a large group of people, and we have gotten some feedback to try to limit that. But first, let me tell you a couple of other things. In addition to adding your full name or any advocacy group or purpose you might have in joining us, be aware that DW, one of our board members from Spokane, has added our link to our website. We would love it if you could donate to us. Every dollar helps. We try to raise at least a couple $100 at each meeting that we have. So if you are able, please click on that link and make a donation. You can also volunteer there. The chat is also going to be used for questions tonight. I know that Zoom has a Q&A place, but Consuelo Echeverria, did I pronounce that close to correctly? It's supposed to roll. Echeverria will be leading our Q&A at the end of our presentation. So anytime during the evening, please feel free to add a question to the chat. And then the last announcement is about live transcript. If you hover over the bottom of your screen, you'll see almost like the third little button from the right at the bottom of your screen says live transcript. And if you click on that, you'll see the choice of seeing, viewing a subtitle. You also can view even more information by hitting view full transcript. So that's another option. So subtitles are available. We will be monitoring the chat to try to put questions together, so please feel free to enter those. We're meeting today on the lands of the Coast Salish people. Even though we may be in the air above that land, it's all connected. We're engaging in efforts to achieve equity in healthcare, and we ask that each of you take a minute to reflect on the inequity that affects indigenous peoples, because their lands on which we reside have been stolen from them. We acknowledge all the ancestral homelands and traditional territories of the indigenous peoples who have been here since time immemorial. In our efforts to achieve equity in healthcare, and shall include universal healthcare coverage for the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Puyallup, Suquamish, Tulalip, and Muckleshoot nations. So now I'd like to introduce or to bring onto the screen Vicki Lowe, and who is the chair of the Universal Healthcare Commission and a health advocate for people all across the country, all across the state. And also, Sherry, I'm going to bring you into the picture too. And if you could both unmute. Sherry, I see that you're still muted. But we had invited all of the members of the Universal Healthcare Commission to come and meet with us tonight. And I got some feedback from the Healthcare Authority and the Attorney General's office that in order to prevent the public perception of a conflict, of actually having a meeting of the commission that without announcing it or making it available to all of the public, that we should probably limit that. So what I did was uninvite everyone and only invited Vicki Lowe to share that with us. The perception or the public perception that could be violated is called the Open Public Meetings Act. And I thought, Vicki, you might share a disclaimer about that.
Thank you, Ronnie. Thank you, everyone, for joining us tonight. I tong in. Good evening. Vicki Lowe, Statithlan New Sklayam. My name is Vicki Lowe. I'm Jamestown Sklallam. I'm also Bella Coola First Nations. And I had the pleasure of taking the Open Public Meetings Act training 3 times last week because of the different positions. For the Universal Health Care Commission, I'm on the Missing and Murdered Indigenous Women and Peoples Task Force, and I'm a newly elected city council member here in the city of Sequim. So I feel really familiar with the act and really the importance of what they call sunshine laws, so laws that shine a light on government and make sure that government is not making decisions that the public don't understand or get to see happen. So the not having a quorum here is important because it's just you guys, there's a whole process to having an open public meeting and posting and making sure that people have access to it. And even though it's just me here, it's still, we want to make sure that it's understood that there's no action happening for the commission. That is something that will happen in the commission meetings that I hope that many of you can join. They're happening during the day and you can't join them. There will always be video and an opportunity for public comments. I think it's really important the public comments get to the members of the commission because the decisions that will be made by the commission will impact you all the most. So I just wanted to make sure that you guys understood why it's just me here, and we apologize we couldn't do something with more people, but we just want to make sure that we're not doing anything to jeopardize the commission at all as well. So thank you for being understanding and being here tonight.
And I think what you're emphasizing is that this is not, this is a transparent, open commission, and our intention tonight, or our advice tonight, was not that we want to limit information for each of you or for the public. It is really just to prevent that incorrect perception. So let's get started. Sherry, do you want to start and ask an opening question?
Yes, Vicki. First of all, welcome. And I enjoyed serving with you on the Universal Healthcare Work Group that formed the basis for the legislation that puts you now in charge of the Universal Healthcare Commission. And first of all, I want to wish you the best of luck in dealing with this issue as your work goes forward. Okay, now that I've said that, what do you view as the charge or purpose, the charge to the commission or the purpose?
So Sherry, let me interrupt. Those are the questions for later. The follow-up questions. The first question is really just asking. I'm sorry to interrupt you, Sherry.
I thought I was going to ask this one first.
The first question.
Vicki, miscommunications. My fault.
My fault. I pumped that in separately to you, but really we just want to get started asking you your relationship to universal healthcare.
You're right. You're right.
And your commitment to making that. I know you shared it on November 30th at that first opening meeting, but somebody somebody interrupted you. So now's your chance. We get a second chance. You get a second chance at this. So that would be a great start. So I'm going to mute myself and get out of the.
Thank you. And thank you, Dr. Weinberg. I really enjoyed serving on the Universal Healthcare Work Group with you as well, and Ronnie, and many other people. But when we were introducing ourselves during the commission meeting on the 30th, my dog started barking. And so I didn't get to say all the things I wanted to say because I have a background in working 25 years in the Indian healthcare delivery system. I think people wonder what that has to do with universal healthcare. And first of all, the Indian healthcare delivery system is universal healthcare. It's just chronically underfunded. You know, I told a little bit about my personal story of being a pregnant teenager and finding out that my pregnancy wasn't covered by my dad's insurance because insurance didn't cover the pregnancy of a dependent. And that's still a practice of the insurance companies today. I mean, my daughter's 39, so this has been going on for quite some time. So I spent all of the money I'd saved for college on the pregnancy and birth of my child. And so that greatly impacted my life and the choices that I had to make after that. But when I went to work for the Jamestown Squaw Tribe in 1996, we didn't have a clinic. So we bought insurance for our tribal members. And if they had Medicaid, we helped them use it. If they had, or if they were eligible for it, we helped them sign up for it. If they had Medicare, we helped them use that. Private insurance, we bought Washington Basic Health Plan back when it was a thing, when it had the subsidized and non-subsidized. I convinced Kitsap Physician Services to make a plan for tribal members, which was really unheard of back in the 90s because the insurance companies certainly couldn't understand the relationship that a tribe has with their tribal members is greater than the employee-employer relationship. And then a few years later, the tribe did start a clinic and I helped with the contracting. And then I helped the Jamestown tribe establish a self-funded employee insurance plan. So I have a lot of experience with helping people use insurance coverage and Medicare and Medicaid. I've seen a lot of the barriers. And then a lot of that frustration from those barriers as I moved into my position now as the executive director of the American Indian Health Commission, got to start to work at the state level with trying to help figure out how to get rid of some of those barriers. And in the last few years, I've actually learned about the legislative process by helping draft and pass some different pieces of legislation. But really that experience I had when I was a teenager and having this huge financial issue with being pregnant and not having coverage, and the struggle I had after that. And then also with helping our tribal members trying to access care and just some of the things that happen to them, some of the perceptions that people have about people who are on Medicaid or that have their coverage through Indian Health, and that somehow that's taken away from somebody. It just seems really unfair to me that healthcare really is about money. It should be about taking care of people. So I, really fully support universal health care. And when this bill was being written, I actually went and gave testimony in support of it because I just really think it's very important. I'm happy that it passed. I enjoyed being on the Universal Healthcare Work Group. And I think, Washington is the place that this can happen because we are really progressive here. We have all these, this history of really taking care of people, the expansion of the coverage for kids through Medicaid in the 90s was an example of that. But I just want to make sure that people understood some of my history and didn't think that I was coming from a completely different system and trying to do something I didn't have knowledge about, I guess. So thank you for giving that opportunity to share that, Ronnie and Dr. Weinberg.
Well, thanks, Vicki. And we are all so excited about having you in a leadership role. We're looking forward to hearing more comments like that from you as issues come up. I think that's a great perspective. I couldn't think of anyone better to lead this commission. So thanks for doing that. So we're going to take the next few minutes to hear from the other members of the commission. They introduce themselves. I don't think, although somebody had a crying baby, I don't think anybody else had barking dogs, but we're going to take the next 20 minutes to meet each, to hear these greetings with each of the other members of the commission. Two people were not there, Senator Ann Rivers, who is actually not going to be in the legislature. She's taken another job, maybe on the same level that you're on, a similar level that you're on, Vicki. And so we won't hear from Senator Rivers. And Badisha Mandel from Washington State University was not present. But let's go ahead and get started with the other members. So I'm going to remove my picture and Vicki's picture and share a video that, and thank you to DW for preparing this for us.
Good morning, everyone. I'm Dave Eisminger. I am the designee on behalf of Sue Birch for the Healthcare Authority. At the Healthcare Authority, I'm the director of the Employee and Retiree Benefits Division, which is the primary part of the Healthcare Authority that administers the commercial books of business that HCA runs, which is the Public Employee Benefits Board Program, or PEB, and the School Employee Benefits Board Program, or SEB. So that is all of the governmental employees, state agencies, higher education, school districts, educational service districts, and approximately 325 political subdivisions that contract and access PEB benefits. So that's cities, counties, municipalities, fire districts, library districts, water districts, sewer districts, public hospital districts, anything that has the word district in it. So I am excited to be here. A little bit more about my background. I've been with the Healthcare Authority since 2013. I became of K-12 benefits into the single state program. So I've seen a lot of work over the last couple of years that really, I think, lends itself to thinking about bigger, bolder efforts that could happen within insurance coverage. And the reason I share that is similar to kind of Vicki's experience. I learned the value of insurance at a young age. There are some people who just, their families don't have the genetic, they don't have the genetic good lottery, they have the genetic bad lottery, and they utilize healthcare a lot. And so I've understood the value and importance of pooled insurance risks from a very early age. And so it's always something that has drawn me in. And so I'm excited to be here. Thanks, everyone.
Thank you, Dave. Emily?
Hi there, I'm Senator Emily Randall from the 26th Legislative District. It's on the Kitsap Peninsula, Bremerton, Port Orchard, Gig Harbor, and Key Peninsula in Pierce County. I am so excited for today that we are starting this work. It's been, I know, a very, very long time coming for advocates on this call, but since my first session in the legislature in 2019, this has been a real passion of mine. And before I entered the world of politics as a little girl, I experienced, our family's first experience with a medical system that wasn't working for everyone, but we got lucky because in 1993, when my sister was born with pretty severe developmental disabilities, Washington's legislature expanded Medicaid, and Olivia got covered. And so we didn't have to worry about, losing our house. We're paying for some bills instead of Olivia's care. And so we know that we have a good template for how we can keep leading the country and keep covering more people. And so I'm excited that we're starting this work today so that we can continue that incredible legacy and ensure that every Washingtonian has access to the care that they need when they need it.
Thank you, Emily. Estelle?
Hello, everyone. My name is Dr. Estelle Williams. I am a acute care general surgeon at the University of Washington Montlake campus in Seattle. I hail originally from Oakland, California, and came to the University of Washington for medical school and eventually stayed for my residency training and now stayed on as faculty within the Department of Surgery. I also acted in the School of Medicine as the executive director for the Center for Workforce Inclusion and Healthcare System Equity, addressing healthcare workforce diversification by engaging our youth starting in K all the way through college to encourage, mentor, and support students, especially those who are traditionally underrepresented in medicine, to consider a career in healthcare. My perspective on and excitement in being involved in this commission stems from both personal experience and family experience within healthcare. I think as some of us share similar stories, I was uninsured for most of my life because my father worked in construction and was not a union member that was afforded healthcare. And so although I had the dreams of becoming a doctor, I actually didn't see one regularly, and also engaged with family and friends who had to access healthcare through the emergency department as their only means. I am home on maternity leave with a 1-month-old, so excuse the baby in the background, but excited to be here.
Thank you, Estelle. Jane?
Good afternoon, everybody, and congratulations, Dr. Williams. That's lovely. I have two, and I never regretted it for a minute. So my name is Jane Beyer, and I am Commissioner Kreidler's Senior Health Policy Advisor here at the Office of the Insurance Commissioner. We regulate fully insured health plans that about 1.3 million people in the state get their coverage through. And what do I bring to this? Many of you have worked with me over the years. I did 20 years as a legislative staffer. I did a stint as the state Medicaid director. I did a stint as the state's behavioral health commissioner. And I think the most important thing I learned over all of those years is that incremental strategies work. We did it with maternal and child health. We had the Washington Basic Health Plan, and that morphed into the Affordable Care Act. There were bumps along the way, like the repeal of much of the Washington Health Services Act. But one of the things that retained even and despite repeal was the Medicaid expansion for kids that was enacted in 1993. So I bring a historical perspective and am so appreciative that Vicki is going to be our leader. Thanks.
Thank you, Jane. Joan?
Hi, good afternoon, everybody. My name is Joan Altman. I'm the Director of Government Affairs and Strategic Partnerships at the Exchange. So serving on the commission is Pam McEwen's designee, who's the CEO of the Exchange. The Exchange runs Washington Health Plan Finder that 1 in 4 people in Washington are currently using to access medical and dental care. I think in terms of my background, I've been at the Exchange since we launched. It's been a journey and been involved with lots of you working on sort of reforms and policies to help expand access and improve affordability. So seeing this work as an extension of that work and very excited to be in your company. I hail from the East Coast. I have a background in public health and health law and have worked in health policy for longer than I am going to admit on this call at both with nonprofits. I was at the federal level with CMS and now for several years here at the state level. So on a more personal note, I sort of have experienced chronic illness and have seen healthcare up close from someone with a lot of need. And I also am the product of two physicians from rural Maine who I saw, my parents patients would barter with my parents. They would get paid in potatoes, which is a great thing to get paid for if you're from Maine, and other types of produce. So just really have seen up close what insurance can do and what access to healthcare can do, particularly for rural communities and for queer communities. So excited to bring that lens to this work.
Thank you, Joan. Joe?
Representative Joe Schmick, represent the 9th District, which currently is the southern part of Spokane County, Whitman, Adams, Asotin, Garfield, and most of Franklin County. I'm the ranking member on the House Healthcare and Wellness Committee, and I bring a pretty good understanding of rural needs. And so I'm glad to be here. Thank you.
Thank you. Karen?
Hi, thank you for inviting us to this kickoff meeting. I'm Tasha Tisdale, Executive Assistant to Dr. Karen Johnson, who sends her apologies for not being able to attend this afternoon. Dr. Johnson, also known as Dr. J, is the inaugural director of the newly created Office of Equity. Dr. J is an over 40 melanin-enriched queen of African, Blackfoot, Cherokee, Japanese, Jewish, and Seminole descent. She is a cisgender female that uses she, her, and beloved pronouns.
And hello, everyone. I am Cindy Varley, also Executive Assistant to Dr. J. She wants everyone to know, excuse me, that healthcare is so critical as it impacts the people's ability to gain access to health, wealth, and well-being. And the Office of Equity stands to the ready to serve in any way that we can to bring equity and justice for the next 7 generations and beyond. Thank you so much for having us.
Thank you both. That was wonderful. Kristen?
Hi, good afternoon. My name is Kristen Peterson. I am Deputy Secretary for Policy and Planning at the Department of Health. Here on behalf of Secretary of Health, Dr. Shaw. I'm really excited to be here and part of this esteemed group. I have a long-standing passion in healthcare policy, in particular access to care. I worked on policy at the state and federal level for many years, and as with you, I've had my personal experience with healthcare at a young age at a time where I didn't have insurance, so bring that perspective as well. But from a public health perspective, really believe that access to care, both physical and mental, is a critical population health issue, which is what's so fascinating about healthcare. It's also a very personal issue. So looking forward to working with all of you and tackling this important issue. Thank you.
Thank you, Kristen. Marcus?
Hi, everybody. I'm State Representative Marcus Riccelli. I represent the 3rd District, which is Spokane, City of the Spokane largely. I serve on the Healthcare and Wellness Committee, which I've served on since being elected in 2012. Very excited to be here. The community I represent is one of the most impoverished in the state. We have 2 of the 4 census tracts. So how we attack access to care and making sure that everybody has access to quality health care is one of the reasons I ran for office and one of the most motivating factors for remaining in the job. For me, I worked for U.S. Senator Maria Cantwell prior to coming to the legislature, and then was a policy advisor for Senator Lisa Brown when she was majority leader. Since becoming elected, some of the things that I've been working on, I was the prime sponsor for the bill to create the WSU Medical School, and that was really just picking up the baton from our community leaders and a lot of bipartisan support in the legislature. And I've come to work on something that I didn't know a lot about on oral health access. I'm really passionate about how we're expanding that. And then a lot of work on telehealth. In my day job, I work part-time for a community health clinic, and I see a lot of different perspectives with the folks that we serve. So that's me. Thank you so much. This is a really impressive group of folks assembled, and I'm really pleased to be with y'all.
Thank you. Mohammed?
Hi, everyone. I'm also on daddy duty today. We have a 6 weeks old baby boy. Really excited to be here. My name is Mohammed Shidani. I'm a deputy director of Somali Health Board, which is a grassroots, community-based organization. We focus on reducing health disparities to Somalis and immigrants, refugees from Africa and other continents. We have very fast experience with how the trickle-down effect impacts communities, new communities and minority communities, and how important it is for all of us to actually have everybody on the table and have all of those voices represented while we get to work together to give all of Washingtonians coverage, access, and something they can be, not only access and affordability, but also quality care. Quality healthcare means quality life with quality. And I've also served at the work group before this. So I bring a lot of experience in that, but I mainly, want to learn from all of these great people here.
Congratulations to both of you with newborns. Nicole.
Hi, everyone. Good afternoon. And yes, congratulations to Dr. Williams and to Mohammed. Let's see, I am Nicole Gomez. I'm co-founder of Alliance for a Healthy Washington. And I actually worked with community members to help pass the Universal Healthcare Work Group and then this bill creating the Universal Healthcare Commission. This commission actually means a really great deal to me. I've dedicated my postgraduate career as a volunteer to work towards a more equitable, affordable, sustainable healthcare system. My father was a small business owner and he became seriously ill during a time when our family did not have health insurance. And so I know firsthand what it's like to lose a home and a family member to an illness. And that kind of put me on a lifelong track to learn all that I can about various systems affecting health policy. So as an MPA, go Red Hawks, I have a pragmatic approach to analysis. And so my background is advocacy, government policy, legislative experience. And then I've also worked 15 years in various workers' compensation systems nationwide. And so I've done that both as a payer and on the legal side, dealing with the common pitfalls like third-party claims and medical malpractice. So my focus here is just to keep us true to the intent of 5399 and to constantly consider the social determinants of health, and quite honestly, to help us dream of what could be if we think outside the box. So thank you so much, and it's an honor to be here and to work with all you people, all you lovely people. Thanks.
Thank you, Nicole. Stella?
Good afternoon. What a pleasure to be on this commission. I'm very honored to be part of it. My name is Stella Vasquez, and I am currently the Chief Program Operations Officer for Yakima Valley Farm Workers Clinic. My entire career, born and raised in the Yakima Valley, of Hispanic and Filipino descent, but also I've lived on the Yakima Reservation, Indian Reservation, my entire life. My career has been, and my passion has been, serving underserved and unserved populations, particularly in the area of medical. I did 31 years with the state of Washington for DSHS. So I was there during the time that DSHS oversaw Medicaid, so I have quite a bit of experience with that. After leaving there, I've been with almost 20 years with Yakima Valley Farm Workers Clinic, who is a community migrant health center. So certainly saw a whole different side of how access is sometimes not available, or just the complexity of the medical programs. And at the same time, Medicaid was transitioning over to healthcare authority. So I saw some real differences in how you access services through that system. Really pleased, I think, that Washington State has been very progressive in terms of healthcare. And I think someone mentioned earlier that programs such as, First Step. I have overseen First Steps programs, maternal child health, improvements around prenatal. I also oversaw with the clinic mental health system. So certainly have seen the challenges there. But I've seen some real complexity around the managed care system and the managed care plans, although I certainly understand why we transitioned to that type of a system, but I think there's some real gaps. Was really pleased with the Affordable Care Act, but again, I think we can go further to improve access and affordable health care for all. So real excited about doing this, but also, as I indicated, I've had a real passion for all of my life and don't quite want to give that up, but I will be retiring in the very near future with Yakima Valley Farm Workers Clinic. So I also saw this commission as an opportunity for me to continue to work in that area of healthcare. So thank you for letting me be part of this.
Well, thank you, Stella, and everyone else on the commission, and especially Vicki, who's joining us here tonight. I'm looking forward to getting to know these people more and more. So let's bring back Vicki and Sherry, and what we thought we would do now is ask, give Sherry a chance to ask Vicki a couple of more questions going beyond what we've just heard. So Sherry, do you want to take it from here?
Yes, I will. So Vicki, now I get to say what I started to say earlier, which is, what do you view as the charge to the commission, or another way to put it, as the purpose of the commission?
Yeah, wow. So our purpose is to get to a single payer system, but within the law that was written, 5399, it gives the opportunity to do that in an incremental way. And I think that's the most important part is, some people mentioned the Affordable Care Act, which I think was a great first step, but it was pretty sweeping change that got a lot of backlash. So I think it's really important to do this work and bring everybody along with us as we do it. But really getting to a single payer system for all Washingtonians.
So you think it will that we'll have to do it incrementally, that we won't be able to put in place a cover everybody plan and then work to implement that?
Well, the goal is to have universal health care at the end of the time period, 2026, I think is what I've been telling my kids.
Well, I just hope to still be alive, but go on.
But the bill was written in such a way that allows the legislature to make some changes in between now and then. So, that's the thing about this kind of process, is we get to do all this work and make recommendations, but it's still up to the legislature, which is a good thing that we have some legislators on the commission. I think that's really helpful for them to help be a part of it. And, Senator Randall, who sponsored the bill and really helped get it passed, I think she also helped write some of the parts about the incremental pieces in between. I just think it's hard to make sweeping changes. And also, we need to be careful about our most vulnerable population, because when we make big changes and they make, your average person feel uncomfortable, a lot of time those changes have impacts that we don't really see that are coming from our most vulnerable people. So I just think we need to be cautious and thoughtful and think of it, backwards. And this happened a lot with the Universal Healthcare Work Group, where we would be talking about how to get to the system, the benefits, how to bring in the right providers. And the next thing you knew, we'd be talking about premiums and copays. And it's like, because healthcare has been so focused on being health insurance and about money, we really have to focus on it from that perspective of access to care and the people that need the care, and focus on the most vulnerable people. Did I answer your question, Dr. Weinberg?
Yeah, that's a good one, because I view it more from a creating a system, and then how to sell it and how to implement it. But you're right, we need to, part of that is bringing along a wide variety of people in the community that, and it's good that the commission has got a lot of people on it who have a lot more exposure than this octogenarian retired pediatrician does.
No. Gosh, what you know about healthcare is so valuable, Dr. Weinberg. With the Universal Healthcare Work Group, you always got us right back to the point.
Okay, well, and let me say that as long as I'm still going, I am available as a resource to the commission anytime. And I will be a little sharper about that at some times as compared with others, but not now.
Thank you. That is great to know.
Okay, my second question, what do you hope to see as a result of the commission? You've kind of said that, but and then how do we get there from here?
Yeah, and that's that, incremental change management, something I learned from my sister. I think it's something we do, but giving it a name sometimes helps understand the process, that we really have to sometimes inch our way towards big change in order to not overwhelm people, and also, again, be cautious that the changes we make aren't having adverse effects, again, on the most vulnerable people. So, there's going to be a lot of moving parts, I think, with the work that will be done. And again, I have told my kids that I really want to see them not have to worry about having insurance coverage by 2026. I hope we can do it. I mean, that's still a big task to do that, but that's the hope.
Yeah.
Well, thanks, Sherry, for leading those questions. And before we bring in some more questions from the chat, and just to remind anyone that you can enter questions for Vicki into the chat. And they also remind you that we have put the website, the link to go in and reach our website, the Healthcare for All Washington website, and that will give you an opportunity to make a donation to our general fund, our educational fund. So please take a minute to do that. But now I'd like to bring up one of our key volunteers, Chelo or Consuelo Echeverria, who will pull some questions out from the chat, some questions from you.
You need to unmute yourself, Consuelo.
Can everybody hear me?
Yes.
I think I'm going to start with a much wider question to get more to this. If we're going to parse it out, how do we sell it to the public? And Emil Chang asks everybody, what are the ways that this organization can help the United Healthcare Commission in this process? Please be specific. Thank you.
Well, doing just what you're doing tonight here, having us, supporting the commission, sharing information about us, sharing how to access the meetings and the notes. And then, I think it's really important that people understand change as it's happening. And I think most important to feel like you're a part of what's happening. I think coming from working with American Indians, Alaska Natives, healthcare is something, when you don't have a lot of resources, it's something that happens to you. So when it's being changed, there's a lot of fear, because even though it might not be the best situation, at least you know what it is. So there's fear that it could become worse. So just helping us keep people informed about what is going to happen and the changes as hopefully they come, and just, hand holding, and I think is really important.
Okay, and Paul and Nancy Uhlenkamp asked two questions. And these are a little bit more technical, but quite interesting and important, I believe. The legislature has set a deadline of November 1st, 2022 for a baseline report that is required to cover a large number of topics. How will this report be accomplished? How will all the work needed to create an operational universal healthcare system be accomplished?
Those are great questions. Luckily, you know, the legislature funded the Healthcare Authority to help staff the commission. So it's not us all volunteering our time. So they're really the worker bees. As we have these meetings, they set up the agendas and do all the invites and stuff, but they'll also be doing the work in between. And they're actually looking to hire a consulting firm to help with some of that work, like we had with the Universal Healthcare Work Group. That really helped to bring the resources so that we're not doing that as the commissioners, but that the staff is doing those things.
And a second question from Paul and Nancy is, what are the short-term and intermediate-term schedules? The short-term schedule would cover the work through 2022 and the production of the baseline report. And then the intermediate schedule would cover the rest. Is that what we're thinking?
If I'm understanding the questions right, yes. So we'll be meeting every 2 months through next year. I think we've got the meetings all scheduled out. And then, you know, if there's things that happen in between, we'll have to deal with them. But again, we have to the Open Public Meetings Act rules to follow. So we have to be able to, if we're going to have a special meeting, we have to give notice and all those things. And I think as we move through, you know, we'll know better what's going to happen in the next year. But I imagine it will be a lot the same because we want to keep up that pace and keep the changes happening. You know, it's going to take a lot of work. And it is a lot of change from what we have. So I think we're just going to have to hunker down and continue meeting at least every other month.
And just so everybody will know who's attending the meeting, our Healthcare for All website will be posting those meetings and links to them on a regular basis. Is that not right, Ronnie? Okay, so please.
That's right.
Please do keep on checking in on the website to get the most recent links to attend those meetings. We have the same question from a couple of different people, from David Lord, I hope I'm pronouncing his name correctly, and Chris Curry.
David Lowe.
Loud, I'm sorry. David, please, excuse me, I'm so sorry. You could be Lord. Okay, so Chris Curry asks, and David asks, how are you planning to handle the two models of the UHC discussion work group, since the work group did not officially recommend option A? And just to remind you, option A was the publicly funded, and option 2 farms out the administration to private risk-bearing health plans.
I remember the conversation. And we did make sure that our voices were all heard right there at the end. We made sure that each of us were able to say which option and why we chose it. And I think, you know, the work group, there was some difference of opinion, let me say, about if they were an advisory work group, you know, if they were supposed to make a recommendation to the legislature. So I think the commission is a little bit different because we are working to make recommendations. So, and if I remember, it was definitely most people picked A, but there should be steps and a path, and you know, and that's definitely what I think, but I am one voting member on the whole board, so I can't say what other people think, but yeah.
I think do we have time for one final question?
Yeah, one more.
Okay, so this is from Diana, and Dale. Do you, Vicki, have any thoughts about the relevance of the original health reform plan that the former governor, and I'm going to murder his name, Kitzhaber from Oregon, Kitzhaber, I don't know how to pronounce his name, that the former governor from Oregon creating the coordinated care organization for the Medicaid population that was intended to expand the state employees and then private businesses.
Kitzhaber.
Is that model at all relevant to what we're going to be doing here?
You know, I only really understand about from those CCOs, coordinated care coordination organizations. I can't remember the exact, from the tribal perspective and how the tribes have worked with them. I do think that it's important to look at what's been done in other states and really see what's worked, and think about how that can be incorporated into what we're doing here. Again, that's the importance of having the HCA staff and those consultants really bring those resources in so we can look at them and think about them.
Well, thank you, Consuelo, for bringing those questions forward. Thank everyone for giving her some questions to ask. Thank you, Vicki, for joining us tonight. Your last comments about the preparedness or the work that Washington State can do, we can be a leader. And the last question was about another state, and we don't have to do this alone. There are other people struggling with these same issues. Washington State has a commission that you are leading to make this happen. So I think we'll have some other people contacting us that we don't have to do it alone. We can build on what's going on in other states. We can work on coalitions. There certainly are national movements to do that. So Vicki, thanks for joining us tonight, for being available at any of our calls. You have come before and shared some specific information, which you can find on our website. If you click the icon that says YouTube and goes to our YouTube channel, you can see a conversation that Vicki led us in on tribal health, on like Tribal Health 101, and your advice. One of the things, the takeaways, was for us to watch that movie on, Get Sick Before June, or I forget the title of the movie, but it talked about the fact that our healthcare is tied to budgets, to limitations. And if you don't get your healthcare by June, you might not get it for the rest of the year. And that's a crime, a crime against us all. So thanks for joining us. Thanks for sharing some more messages. And as Vicki said, please join these commission meetings, make comments, go to the Healthcare Authority website where you can sign up for communications or for contacts about it. The next meeting is early January 4th. So everybody put it on your calendar, and thank you again, Vicki. I thank you very much for joining us.
Thank you. Thank you for having me. And please submit public comments. It's really important that the public be a part of this process. So thank you.
So thank you everyone for giving us questions to share with Vicki, and for joining us tonight. Remind you one last time that our website is in the chat. So if you are in a position to make a donation, please help do that. You also can find a place to volunteer, just like Consuelo was sharing with us. The website will also give you that opportunity, or a location to volunteer and join in the struggle. We will meet again on every second Wednesday. On January 12th, we have a coalition of healthcare providers to discuss the health impact of climate change, and get that conversation commission going. Chris Covert-Bolds, a member of our board and a leader in Physicians for Social Responsibility in Washington State, will bring in a coalition to discuss that. And in addition, we'll be bringing another member from the commission, the Universal Healthcare Commission, to offer their greetings and to share a few Q&A or answer a few questions for joining us. So please feel free to or put that on your calendar to join us on that date. And watch for our website for comments, the reports of the commission, public comments that the commission has shared with us. We'll be putting that on our website. And again, appreciate everyone for joining us tonight. Thank you. Thank you very much. And we've done it in time, and we'd like to end in respect for everyone who's carved out the time in their schedules. So have a lovely evening, a good holiday and New Year's, which probably isn't relaxing for everyone, but there's got to be some relaxing moments there. Take advantage of that and have a good holiday season. So thank you all very much.